Did you know that after age 60 your body can lose up to 3% of muscle mass each year without you even noticing? This not only affects your strength but also your balance, mobility, and ability to live independently. Most people only realize what they've lost after their first serious fall. But there's something almost no one tells you. There are 5 specific exercises that can slow this process down and even restore strength and stability. They are simple, powerful, and easy to do at home, with variations for those who have limitations. They are your best defense against age-related decline. So, if you're ready to improve your joint and muscle health, we invite you to keep watching this video until the end, as we will show you the key to maintaining your muscle mass, even if you're over 60. Exercise 1. Glute Bridge. As we age, one of the muscle groups that loses strength and tone the fastest is the glutes, specifically the gluteus maximus, the largest and strongest muscle in the human body. Its weakening directly affects everyday functions like walking, climbing stairs, maintaining balance, and even standing without fatigue. This loss of strength and activation is known as gluteal amnesia, and it occurs especially in people who spend many hours sitting, which neurologically disconnects the glutes from their main function, hip extension and postural support. Studies published in the Journal of Orthopedic and Sports Physical Therapy have shown that weak gluteal muscles are correlated with a higher risk of injuries in the lower back, knees, and hips, since the body compensates by using muscles that aren't designed for those functions, generating unnecessary strain and chronic pain. This is where the glute bridge becomes a key tool for reversing these effects and strengthening not only the gluteus maximus, but also the gluteus medius and hamstrings, promoting a strong and functional posterior chain. In addition to being an exercise accessible to all ages, the glute bridge offers clinically supported benefits in terms of improved pelvic stability, neuromuscular activation, and reduced lower back pain. Published research has shown that the glute bridge generates muscle activation comparable to more complex exercises like weighted squats, but with less joint load, making it ideal for people over 40 who want to gain strength without the risk of injury. Regular practice has also been shown to improve proprioception, that is, the body's ability to locate itself in space, which contributes to better posture and fall prevention. To perform it correctly, lie on your back with your knees bent and feet firmly planted on the ground. Take a deep breath before starting, and as you exhale, slowly lift your pelvis upward while strongly squeezing your glutes. The key is to keep your abdomen active and not overextend the lumbar spine. Hold the elevated position for 2 seconds and then slowly lower while inhaling again. Perform 3 sets of 8 to 12 repetitions, at least 3 times a week. As you progress, you can intensify the exercise by lifting one leg or using a resistance band around your knees to increase activation. This exercise, although simple in appearance, is one of the most effective pillars for protecting your mobility, postural health, and functional independence as you age. Exercise 2. Squats. Squats are not just a classic exercise in the fitness world, but also a functional and powerful tool for anyone who wants to maintain their physical independence as they age. This compound movement primarily activates the quadriceps, glutes, and core muscles, all essential for performing daily tasks like getting up from a chair, climbing stairs, or simply walking safely. As we pass age 40, muscle mass and strength begin to naturally decline in a process known as sarcopenia, which increases the risk of weakness, loss of balance, and falls. However, research has shown that regular squat practice can counteract this process. A study published in the Journal of Strength and Conditioning Research, 2014, found that older adults who included squats in their routine significantly improved their functional strength, stability, and coordination compared to those who did less demanding exercises. This strength improvement not only helps maintain autonomy but also decreases the risk of fractures, joint injuries, and postural problems derived from a sedentary lifestyle. From a biomechanical perspective, squats mimic a natural movement pattern of the human body, making them an ideal exercise to train the muscles involved in daily motions. Moreover, this exercise not only works the lower body but, when executed properly, also requires significant core activation to stabilize the spine, and good mobility of the ankles, hips, and thoracic spine. In the long term, performing squats in a controlled manner improves bone density, especially important for postmenopausal women and men over 50, increases basal metabolism by boosting active muscle mass, and strengthens tendons and ligaments, reducing joint wear. To perform them correctly, start with your feet shoulder-width apart and toes slightly pointing outward. Keep your chest lifted, back neutral, and abdomen tight. As you descend, push your hips back as if you were going to sit down, making sure your knees don't collapse inward and your heels stay firmly on the ground. Breathing is key. Inhale on the way down and exhale on the way up, focusing on activating your core and glutes as you return to the starting position. If you're just starting out or have mobility limitations, you can use a chair as a guide or perform assisted squats with wall support. As you progress, adding light dumbbells or resistance bands can increase the intensity and benefits of the exercise. In summary, squats are a cornerstone in building a strong, functional, and time-resistant body. Regularly incorporating them into your routine will not only help you look better but move with more safety, energy, and confidence every day. Exercise 3. Heel raises. Heel raises are a seemingly simple exercise, but scientifically powerful, especially for people over 40 who want to maintain mobility, prevent falls, and improve circulatory health. This movement strengthens the calf muscles, primarily the gastrocnemius and soleus, which play a crucial role in locomotion and postural stability. Calves are commonly known as the second heart of the body due to their function as a muscle pump. During contraction, they help push venous blood from the lower limbs back to the heart, fighting against gravity. This action promotes blood circulation and prevents common age-related problems such as venous insufficiency, fluid retention, nighttime cramps, and the appearance of varicose veins. According to an article published in Vascular Medicine, strengthening the calf muscles significantly improves venous return and reduces symptoms associated with peripheral vascular diseases, especially in older adults and sedentary individuals. In addition to its circulatory benefits, heel raises are essential for balance and fall prevention, one of the greatest health risks in old age. Statistics from the World Health Organization show that 1 in 3 adults over 65 suffers at least one fall per year, and many of these falls are due to weakness in the distal leg muscles. By strengthening the calves, postural control is also improved, as these muscles stabilize the ankle and allow for quick corrections when off balance while walking or standing. It has also been proven that specific work on the plantar muscles improves proprioception, the body's ability to perceive its position in space, which is vital for maintaining stability on uneven surfaces or when changing direction. To perform this exercise correctly, stand with your feet shoulder-width apart, engage your core to maintain good posture, and slowly raise your heels until you're standing on the balls of your feet. Hold the position for 2 seconds, focusing on contracting the calves, and lower in a controlled manner. Perform 3 sets of 10 to 15 repetitions, 3 times a week. If you want a greater challenge, you can do it one leg at a time or on a step, allowing for greater range of motion and muscle activation. This exercise, although simple, has a profound impact on your quality of life and your ability to stay agile, independent, and healthy as the years go by. Exercise 4. Scapular retraction. Scapular retraction is a key exercise for strengthening the upper back, especially the middle trapezius, rhomboids, and spinal erectors, muscles that tend to weaken over time due to poor postural habits, such as spending hours in front of screens, driving, or simply looking down while using mobile devices. Starting in your 40s, it's common for the shoulders to start rounding forward and the upper back to hunch, which not only affects appearance and posture but can also compromise breathing, cause neck pain, and lead to chronic conditions like thoracic hyperkyphosis. Scapular retraction with a resistance band directly combats this deterioration by stimulating the muscles that keep the shoulder blades in their correct anatomical position. According to a study published in the Journal of Orthopedic and Sports Physical Therapy, scapular retraction exercises help restore postural alignment, improve thoracic mobility, and significantly reduce pain in the cervical and upper thoracic areas. This is especially relevant for older adults, since a hunched posture is also associated with an increased risk of falls, reduced lung capacity, and a lower quality of life. In addition to postural benefits, this exercise activates the stabilizing muscles of the shoulder girdle, which are key to maintaining upper body functionality. By strengthening these muscles, control and coordination in daily activities like pushing, pulling, carrying bags, or lifting objects are improved. This becomes even more important considering that muscle loss doesn't only affect the legs or torso, but also the shoulders and upper back, increasing the risk of injury from repetitive or unbalanced movements. Performing scapular retraction is simple and highly effective. To do it correctly, secure a firm resistance band at chest height, with your arms extended forward and elbows slightly bent. Engage your core and slowly pull the band back, focusing on bringing your shoulder blades together as if you were trying to hold a coin between them. Hold that contraction for 2 seconds, breathing in a controlled manner, and then slowly return to the starting position. Ideally, perform 3 sets of 8 to 12 repetitions, at least 3 times a week. As you progress, you can use a band with greater resistance or perform the exercise at an incline to increase difficulty. Including this exercise in your routine will not only help you maintain a strong and upright posture, but also make you feel stronger, more confident, and energized in your daily activities. Exercise 5. Push-ups. Push-ups, also known as push-ups, are one of the most effective and accessible exercises for working the upper body and core, especially in people over 40. This movement involves a large number of muscle groups at once, including the pectoralis major, chest, deltoids, shoulders, triceps brachii, back of the arm, and the abdominal and lumbar muscles that make up the core. Strengthening this region not only improves physical appearance, but is essential for performing daily tasks such as pushing a door, getting up from the floor, or carrying objects. As we age, the progressive loss of muscle mass, a condition known as sarcopenia, compromises strength and functional autonomy. According to a study published in Age and Aging, pushing exercises like push-ups contribute significantly to the preservation of muscle mass, increasing functional strength and preventing physical decline in older adults. In addition, push-ups offer a moderate cardiovascular benefit by increasing heart rate, especially when performed in continuous sets. This component is important, as the American College of Sports Medicine recommends combining strength and endurance exercises to optimize metabolic health and reduce the risk of chronic diseases such as hypertension, type 2 diabetes, and cardiovascular disease. For those who are starting or have physical limitations, adapted variations such as wall push-ups or elevated surface push-ups are ideal for building strength safely and progressively. To do them against the wall, stand facing a flat, firm surface with your hands at shoulder height. Take 1 or 2 steps back to tilt your body, keeping your core tight and your body aligned. Slowly bend your elbows as you bring your chest toward the wall, then push to return to the starting position. This type of push-up reduces the load on the joints and facilitates a controlled execution, ideal for those suffering from stiffness or weakness in the shoulders and wrists. As you gain strength and confidence, you can move on to push-ups on a lower surface, such as a table or bench, and then perform traditional floor push-ups, first with knees supported, then in their full form. Including this exercise in your routine 3 times a week, with 3 sets of 8 to 12 repetitions, will make a big difference in your overall strength, posture, cardiovascular health, and functional capacity to face daily life with energy and confidence. The key to achieving lasting results in your physical health does not lie solely in exercising sporadically, but in developing a consistent practice, adapted to your individual abilities and sustained over time. As we age, the body responds differently to training stimuli. It's not about extreme intensity, but about regularity and intelligent progression. Science has shown that even short sessions of moderate exercise, performed consistently, can have significant effects on muscle strength, joint mobility, cardiovascular health, and the prevention of metabolic diseases. According to a meta-analysis published in The Lancet, performing physical activity regularly, even in small doses, reduces the risk of all-cause mortality, improves cognitive function, and decreases symptoms of anxiety and depression. That's why incorporating exercises like heel raises, squats, glute bridges, or adapted push-ups 3 times a week can make a big difference in your ability to care for yourself, climb stairs, walk safely, or simply enjoy your day without limitations. It's important to remember that every body has its own pace of adaptation. Listening to your body and progressing step by step, celebrating each small achievement, can be far more powerful than trying to do too much, too soon. This approach not only strengthens your body, but also your mind, cultivating a positive mindset of self-care and resilience. Consistency transforms exercise into a healthy habit that naturally integrates into your lifestyle. It's not about competing with others, but about surpassing your own version of yesterday. That's why, if this content has been helpful to you, I invite you to like this video, subscribe to the channel, and activate the notification bell. Always remember, it's never too late to start taking care of yourself, because every day you choose to move is a step toward a more active, fulfilling, and happy life. I wish you strength, energy, and well-being at every stage of your journey. Your body and your health will thank you. See you in the next video.